global knowledge to the local level. But we can do that only when the local community accepts it. So acceptance can be there only when we co-create the knowledge along with them.
Whose voice can we be missing? People with disabilities' voices are missing in the current discourse. Patients' voices as well, even caregivers. These caregivers could be community members, it could also be women, because mostly in hospitals you see that it's the women that are giving care to those family members that are sick. We also have the rural population, whose voices are missing in the current discourse, and also the youths.
I mean, we need to speak to more people outside of the scientific community and create new spaces for how we work collaboratively with communities from low and middle income countries in particular. That bring forward voices from these countries, and we need to reimagine what these conversations look like.
What does that look like?
I think it's not just about creating new seats at the table, it's actually about building a new table. You know, we bring together interdisciplinary, indigenous knowledge and co-create the future that we all want.
You know, we're used to hearing the voices from majority groups, which are predominantly white, heterosexual, affluent people, particularly from the Northern Hemisphere, from high-income countries in North America and in Europe. And we have historically not heard the voices from the majority of the global population, from historically marginalized groups, from ethnic and racial minorities, from socioeconomically disadvantaged, from women compared to men, from sexual minorities, from people living in Africa and other lower middle income countries. And so we really are missing on hearing the perspectives of the majority of the world when it comes to their health and their healthcare and their preferences and how they prefer to gain knowledge around health and health seeking and treatments.
There's also the voices of the many underserved communities around the world. They're missing not only in HTA, but in evidence generation. And if we're serious about improving health outcomes, it's vital that we connect with them. These communities have often been stigmatized and may distrust our health systems and our decision makers.
It's an entire system shift that needs to happen toward more equitable practice, including practitioners holding each other account to our behaviors pre, during, and after engaging with different spaces.
So we have to build the trust. We have to engage with them in a dialogue to make them understand the importance of the global phenomena and try to understand their context. And then maybe we can integrate both the things together, and then we can come up with something that is easily adaptable for them.
If I were to take IDRC's way of working as an example, a lot of times when we support project development, we will be very explicit that we don't like to see tokenistic engagement of local communities or stakeholder groups, but we in fact like to see budget set aside for individuals to be key members and meaningful participants in different parts.
I think it's really a tough one because there's a ripple effect that comes up from the funders all the way to institutions and further down. So trying to ensure sort of two-way knowledge streams and conversations is really hard to fit into traditional cycles, meaning that if we truly want to work on co-creation at the lowest tiers of power, we do need more time and more resources. And if that isn't provided by funders, it means that ripple effect keeps disrupting potentials for true co-creation.
There's so many barriers. Ethics, for one. The system is there to protect patients, but in their protection, they forget that there can be something that is co-production and that it can actually be a positive experience. And so I think we need to kind of change the ethics surrounding, and not to remove the protections, but to allow the possibility of co-production.
Along with sort of demographic factors or perhaps impairments or exclusions that might limit people's capacity to be included in current discourses relating to knowledge and the evidence base that exists, age stages and kind of phases of life also affect whether or not people are kind of actively included in the knowledge generation that affects them. So children and young people, sort of people who aren't adults, have generally been left out of research processes and conversations that directly affect them. Although this is gradually changing. There's some very encouraging work that's happening both locally and internationally in this area. But for disabled young people, this exclusion is kind of intensified.
Now, why does it matter? It matters because, as I said, the whole lived experiences that shape how evidence is used in practice, yet they are usually perceived as passive recipients and not as co-creators of the knowledge base that we are sharing. So how can we engage them? The first thing is by using participatory approaches, collecting value stories from them and ensuring that we are creating that dialogue space.
I think it's also about being really mindful about how you enable the spaces. I know people always say you have to empower people, and I don't really believe that we can empower others, because people already hold certain powers. Everybody has a superpower, but we can enable a space or a platform or an opportunity where they can exercise that. And so I think it's very important about making spaces available rather than capacitating or empowering somebody else.
If funders can consider funding and publishing locally led research, this will help to bring the voices of the global south, traditional and indigenous voices, youths from the global south into the decision-making space, thereby improving on the knowledge base and ensuring that everyone's voice is contributing, because at the end of the day, we want to ensure that the knowledge that we are producing reflects the context, is relevant for the context and will be used to influence the livelihoods of that context.